In a previous video, I talked about how the shape of the mandible will determine whether I do a more lingually placed inferior border cut to produce more of a J osteotomy or a more buccally placed inferior border cut. But another consideration when determining which osteotomy to use is the patient's soft tissue. So if a patient has more of a thinner facial profile or if they're more aesthetically driven, having a pronounced J at the inferior border will create more notching at the inferior border that the patient can actually see clinically. And this will actually highlight this pretty well. A very nice paper from Dr. Klaus's group with a patient who's thin and has a more pronounced J osteotomy at the inferior border. In the post-op period with the right shadowing and lighting, you can actually see the notched appearance after healing resolves. And so for patients like that, you can control that by having the inferior border cut end more on the buccal aspect rather than coming all the way to the lingual side. What happens when you produce a J osteotomy, much of that lingual cortical bone will come out to the buccal side, which will then leave just this sliver of lingual plate remaining. And you can see here there's this notch that patients can actually see and feel clinically if they are thinner in profile.